Welcome to the WSCP podcast. Today we're talking about the racial aspect of neglect. We want to have the racial lens on neglect. What does it look like from the multi-agency perspectives? So I've got a panel with me today and we're looking at how it impacts assessments, intervention and recognition of risk. So as we recognise risk and support families in Wandsworth, we have to make sure we're doing our best for our children that live here. So I'm going to introduce our panel. We've got Mensah. So tell us about yourself.
I'm Mensah. I'm currently the Service Manager for Children Looked After, Fostering and Family Time Centre in Wandsworth.
Wow, big demand there, Eric. And?
Hi, I'm Sophie Allen. I'm the Education Safeguarding Lead at Wandsworth. My path has come through education. I'm a former head teacher, practicing head teacher of many years experience, yes, but not a Wandsworth one, sorry.
Okay. And?
I'm Rasheed, Pendry. I'm the Director of Children's Social Care in Wandsworth.
Oh, the big boss.
DCI, which is the Detective Chief Inspector for the Metropolitan Police, and I work in public protection for the South West. So that covers Wandsworth, but we also cover Kingston, Richmond and Merton.
Okay, so a lot of our guests are waiting for the pressure for the police for these questions. So we're glad that you're here. So we are going to open this conversation. It is a really difficult conversation for a lot of people to engage in and to be really honest and transparent about. And we're hoping from our conversation today, we can really just try to assess what's really happening in the community and how we can best safeguard children without the bias of race. And consider maybe, is there a bias? So, Rasheed, I want to ask you, how does race impact children's outcomes in cases of neglect, particularly within Wandsworth, would you say?
So I think I'd go back to your first point, Cam, which was the influence of race on the way in which we think about neglect and work with neglect. So the way that I see it is that race is everywhere. So race impacts on everything that we do. Because in our society, we are set up to privilege white people over black and brown people, and our local authority children's service is no different. So I think we have to start from that as a base, as a given.
And that's quite an uncomfortable statement that people sometimes really can't absorb about white privilege and saying it out loud. For me, this feels like quite a new statement that you make. How has this change come, and why are we so bold in saying it now?
Well, I don't know whether we are so bold in saying it now. I think I can be bold in saying it because I occupy a position of leadership in an organisation, and I'm brown. I see the unfair outcomes for our black and brown families and children every day. I see that black and brown children are more likely to come into care in our system, and that happens nationally. That's not just in Wandsworth. They're less likely to be offered a foster family. They're more likely to end up in residential care. They're more likely to be stopped and searched by the police, particularly in Wandsworth. So they're more likely to be criminalised, because the more black and brown people you stop and search, the more successful. I mean, Laura, this is Laura's bag, but the more successful outcomes you'll see. So I think there's a that's unfair. And what we were doing in Wandsworth Children's Services a few months ago is we were calling that disproportionality, and I don't like to call it disproportionality anymore. I like to call it racism, because that's what it is. It's unfair outcomes for black and brown children on the basis of racist ideas, beliefs, assumptions that underpin the work. Now that's not to say that we're accusing everyone of being racist, but it's like recognizing that if that's the context in which we operate, it has to have an impact on the way in which we do our jobs. So we've got to recognise that in the same way that we recognise that violence against women and girls is commonplace and is treated differently in society to violence against men, and is becomes kind of, I want to say, normalised. I don't mean normalised. I mean kind of we become desensitised to it.
I just wanted to just add on to what Rasheed is saying, because I guess working in the organisation under Rasheed is probably having a leader who is bold enough to actually name it, which empowers me as the next level down to be able to have those conversations. So I've joined this organization 2 years going, and having that conversation be so live, those discussions be live, has invited me to do something different when I'm in my practice. So I'm able to have conversations with social workers that I supervise, to think about race, the racial element of the work that we're doing.
But what does that conversation look differently when you're supervising white social workers and black and brown social workers to emphasize that point and to encourage difference and change in how we support families?
So I think for me, there isn't a difference in the sense of what I would say. I would invite social workers. So I would invite you to think about yourself. So think about yourself and what lens you are actually what lens you're looking at this situation with. So if I'm supervising white social workers, I will invite them to think, okay, so when you are thinking about yourself as a white male, white female, what does that look like in how you see this? And I would invite black social workers to do exactly the same thing. So in doing that, I'm inviting them to think about themselves and how they are viewing the problem, how they are viewing the family through their own ideas.
So you receive, and you've been in, for example, the brief intervention service where we receive referrals. Have you recognized a bias from the referrals that you receive where there's maybe cultural insensitivity per se?
Oh yeah, definitely. I think as a team manager, at the front door, you will get referrals that sometimes you're like, okay, if this child was not black, if this was a white child, we would not be getting this referral. So when we're thinking particularly about neglect, we think about the intersections with neglect in terms of poverty, in terms of geography, where families, we know a lot of the families that we work with are on the low income level, and they happen to be based in the parts of the borough that is less resourced. So we see that coming through the referrals. So that's definitely something that I see.
And I was thinking about referrals. So a lot of our referrals, I used to be the MASH manager in Wandsworth, and a large proportion are police referrals, yeah, for the reports, especially over the weekend, you'd come back to hundreds of reports of incidents that's happened, whether it be stop and search, crimes, domestic abuse. And I have recognized the language particularly used is very different when we have black or brown families reported, and again the use of force or the referral rate has changed. What's your feelings about that? Would you say there is disproportionality?
I think personally, I haven't seen it. I've only been in the role since April, but I know that it's a really big conversation in the police at the moment, especially around sort of adultification and victim blaming language. And I know that's something that we are actively looking for, whether that be in meetings, strategy meetings, or even in our daily handovers. In fact, at Southwest, we've now got a SPOC that's purely just there, just to review all our documentation, to look out for that kind of, and then feed that learning back through reflection to officers. Because I think it's just, and it sort of goes back to your point, I don't think it's necessarily being done in a racist way. I think it's just, the Met has been called out for, culture change, etc. And I think it just sort of comes back to that. It's just changing the way that people think and write. And actually, when you point it out to people, they say, oh, yeah, now I understand why that might be. And it's not because they've done it with any malice. It's maybe just a lack of awareness or understanding of how that, by looking at it through a different lens, would make someone else feel.
I think that's absolutely right, and that's the point that I think I'm trying to make when I say, that's the societal context. So ideas and beliefs that you could trace back through history, through slavery, colonialism, impact the way in which we still think about difference and families who show difference. So, for example, if a social worker is working with a black or a white social working with a black or brown family, I would say they are more likely to look for problems, challenges, difficulties that match their ideas and beliefs about how black families operate than not. And those ideas can relate to ways in which we kind of problematize. So absolutely. So I absolutely agree with you, Laura. I think, well, I think for a minority, it might be intentional. And that's in every organisation. And your organisation has, has faced criticism for that in a way that has been very, very public. But I don't think it's not just a police problem; it's a society problem, right? But most of all, it's maybe not unconscious, but it's certainly unintentional. And our job then is to challenge thinking, so that when Eric says about lenses, is to say, as a white worker, how do you think your whiteness and the way in which you see the world is influencing the way that you're thinking about this black family? And do you think you're treating them differently, unfairly, seeing problems where there aren't any, because that's the way in which your whole context has shaped your thinking?
I mean, I'm thinking as well of the education system for me, which should be more standardized, and there should be fairness for all. You're working off a curriculum, right? And it's supposed to be every child matters with every point. But yet we're still having lower outcomes for black and brown children, particularly boys, in the education system. Would you say that the lens of academic practitioners have the same stance, that there is maybe an unconscious bias or conscious bias?
I'd say it's certainly there with a lot of people that work in education. But I was thinking about what you were saying, Eric, about Rasheed kind of setting the pace. And I think within school communities, it is about the person who is running the school and the governing body really being clear about what the expectation is, the core ethos within that education establishment, and the outreach to all stakeholders, and making sure that there's zero tolerance for racism. It's very clearly communicated. It's very evident in the curriculum, in the way that we approach and we work with our communities. However, I can't say that that is consistent, within all educational establishments.
We're still having so many of our young black men that are not succeeding in education, and I'm trying to understand what's the cause for this.
Statistically, black boys achieve really highly at the end of the early years.
At the end of early years?
Early years, they're high attainers.
So what happens?
By the end of Key Stage 2 and further beyond, the curve is down. And that's also the same for our mixed race children as well, particularly boys, but also girls. We mustn't forget our black girls as well.
I think what happens is the reality of the system in which we're operating comes into play. So it's about, in order to be anti-racist and challenge the kind of the white privilege and make things be different, requires not just an awareness but an active doing different. So in education, it means I guess it means more white head teachers being aware of how they might be positioning young black adolescent boys and seeing behavior that they might identify as being behaviorally challenging as different. How might your behavior not be challenging if you are experiencing a day-to-day context in which you might be stopped and searched by the police, or you might be stopped when you're just walking into a shop with your mates, or your family are being denied appropriate housing because the housing system is oppressive, disproportionate too. And you have all of those kind of life factors which go along with racism, which may account for your behavior, and then someone identifies that behavior in a particular way which denies you the opportunities that someone else might have. So it's sophisticated. It's not just about saying don't do this, it's about understanding what is happening for young people that is leading to behavior.
But I think you've been able to have that understanding, because I think social work particularly, we've especially developed, a more systemic way of learning. We're considering social graces, the impact of race, culture, everything. And I'm not sure the other professionals have that level of thinking. And I say that because when we're in school systems, for example, and we're speaking with our DSLs, and I think they still struggle with the really in-depth understanding of intersectionality and the impact of culture on how a family may present itself. So as a black mum going into a school, I'm really conscious that I don't want to come across as this aggressive mum, because often that's what we're labelled in schools, and we can't just go down there and say really what's on our heart, and maybe we're not so strong in our academia in terms of our professional language, just of our upbringing and how we've grown. And it's really quite a daunting experience as a parent working with the education system to ensure that your child has the best outcomes. Would you say that schools and teachers and headmistress have that deeper understanding of thinking what else is happening for the family and the parent and what their journey may have been like to impact how they see education now?
So as I said at the beginning, I'm not, my headship experience is not Wandsworth. It was another borough in London, and I would say within that borough, the lens on racism was absolutely core and part and parcel of everything that we did within education. So we had, lots of a very big project about African Caribbean achievement. We involved parents, we involved governors. We had a whole 2 years of funding to really focus on that, and that was building on a good understanding within schools. However, you can never be complacent, and so it is about really understanding your community, and also I think, to be a good leader, there are times when you just say, actually, this is out of either my comfort zone or out of my experiential zone. And so therefore, and I always say within safeguarding, use the experts. We can't all be experts at everything. And within my own school, that was very much about cultural experts. And so when I walked into my school, it didn't, the teaching staff did not reflect the range of the children, 44 different languages and, all, from ethnic minorities from around, and not enough men, and certainly not enough black men. So I kind of wanted to make sure that my comfort, teaching kind of core was very much reflective of the community, so that we had people there who really understood the life experience, particularly of our black children. So I employed a refugee support worker, for example, who came from the Somali background, because that was our main core in that particular time, and very much new arrival Somali community. So I wouldn't understand. I don't have the experience, the expertise, and so that's what we did.
And that's good. And maybe there are things that we could take up in our education in Wandsworth if they're not being done already. One of the things we're looking at in the anti-racist practice group that we have in the partnership is the disproportionality of young black and brown boys with stop and search. Can you talk us through that in Wandsworth at the moment? Like what are the issues?
I think, it's obviously been highlighted recently around the lack of trust in the police. So I think as part of the sort of new Met for London, which when the new commissioner came in, a lot of that was focusing around trying to build that trust and putting communities first, and being open and honest, and probably similar to what you're saying around, we're recognising that we're not actually the experts and we need to get the voice of those children. So I know that there's a lot going on around sort of scrutiny panels and getting youths involved that have been stop and search, and then using them to sort of assist with officers training so that there's sort of real life experience. I know in Wandsworth, or it's being done across all the boroughs actually, they're looking at, there's certain criteria, but looking at stop and searches and then reviewing those from a sort of multi-agency perspective to look at what we could do better. And as I said, getting the voice of those children, how it made them feel, what could have been done better, and taking those positives and negatives. And it's just really trying to rebuild that trust within the communities and recognising that we have got it wrong in the past.
Yeah. And I mean, as different things happen in the news, we have, major incidences where they feel that somebody may have been addressed or handled or harmed by the police differently. How do you continue to reflect that change in the work that you do?
Well, I guess it sort of comes back to, if we start, and, the processes, the new Met for London came in a while ago now, and, if we start to build those trusts, then the ideal would be that even when those things happen, if you've built that trust, then it, they should be able to, they should hopefully be able to see that it will, I think at the moment we're not there, definitely not there yet, and it, almost every time we build a little bit of trust, something happens, and then we're back to. But hopefully, if we can get a bit further ahead and start to work with more communities, then actually they won't see it as a, it's such a bad thing, I guess.
I mean, Eric, I'm thinking about the families that you assess when you go into homes, you meet with parents and they come to conferences. What would you say that their perspective is on how the professionals that work in safeguarding have in regards to race and culture?
I think a lot of the times families will say that we haven't and when I say we, I mean the whole professional network, we haven't spent enough time to understand them. We haven't been curious, we haven't asked them about their lived experiences enough for them to be able to trust us, to be able to go on the journey that we want them to go on with us. I think trust is definitely one of the things that a lot of families will say, that because we haven't spent enough time to invest that time to ask them those questions about how do they do their, because we're working with families, how do they do their family, how do they do their life?
I mean, trust you've got to earn, and it takes time.
Absolutely.
So that's the issue, isn't it?
Absolutely. But it's about going in and asking those initial questions, going in and just so sometimes we go in with an idea that this is good parenting, this is what good parenting look like.
But are we culturally sensitive?
But that's what I was going to get to.
For anybody, it looks
Absolutely.
different.
That's the bit where we need to go in and seek to understand that family, what it is that they, invite a conversation. Let's not assume that just because actually this has gone wrong, everything else about their ideas, what they bring to parenting, is completely rubbish. And I think.
So I was just going to pick up on your point about seek to understand. So seeking to understand requires us to take a position that we don't understand. So if you take that basic position, we don't understand, I don't understand how your script about parenting would look with your daughter. And it has to be mediated through race, but it has to be mediated through my idea about how it's mediated through race for you.
Oh, how do we do that?
Right. Well, we do that by following Eric's idea that we don't understand. So the only way that I can understand that is to ask you. So Cam, how does your racial identity influence the way in which you parent your daughter? And then I'll know.
But some professionals don't want to look like they don't know. Because I'm called a professional because I know. I'm supposed to be an expert, aren't I? I'm supposed to go into that family and I'm supposed to know. So how am I going to ask you that, tell you I don't know?
And that's our job, to support our workers, right? So Eric's job in supervising his workers is to say, you don't know it all. The family are the expert on their parenting experience. So we shouldn't be imposing any of our norms on them. We should be looking for whether that parenting is or is not, for us in children's services, is it causing that child to suffer significant harm as a result of the parenting they're receiving? That's what the Children Act says. That's our job. It's not about, that's not a white way of doing it, or that's not the white middle class way of doing it, or you haven't given your child an appropriate snack after school, therefore they're being neglected. Those are all norms that are constructed and given to them. We need to understand, and we need to take a position. Tell me more about your family life, your experience. Show me.
So I have a good example, again, being a bit manager, receiving a referral where the family had just moved into the country, and the children went to school, and they said, oh, school asked them, have you had breakfast? Have you had cereal? They're like, no, we had rice this morning. And part of the referral that came in was, oh, the parents do not give them sufficient breakfast. And so when we're unpicking that, we're like, okay, when you say sufficient breakfast, what do you mean? What do you mean about that? And so they go on to, they're not giving breakfast, they're not giving cereal, they're not giving things, and when as much as they're not giving things to sustain the child. And I was like, okay, all right. So when you've spoken to the parents, what have they said about what they've given their child? Because actually, if you were to have a conversation with them, and when we spoke to them, they were able to tell us that actually where we're coming from, that is the food that's going to sustain my child for the whole day, to be alert, to access their education. So it was really interesting that, that whole thing of, we need to be having those conversations. We need to be asking those questions. We need to invite families to just tell us why.
But there's a thin line, because I remember working in another borough, and again, I received a referral. I was a social worker at the time, and it was the school referring that the child had said that they had been hit in the head with the comb, and it was deemed as physical abuse according to the school. And it was, I need to rush out right now. We're worried. Section 47. Went to the family home. Mum was like, "What are you doing here?" So the son has afro hair. And he was sitting down, getting his hair braided in the morning, not wanting to sit down and be still. Mum worried about being late. She's got 5 other kids as well. And as we would say in our culture, she conked him in the head with the comb. So she did that. And then he's gone and said, you know, Mum's always hitting me in the head with the comb. And I was thinking to myself, culturally, oh, how many times I've been conked in the head with the comb? And I had to question, is this actually physical abuse? But I get, police are saying it's an implement. You know, the comb is an implement and Mum is using that for harm. And so for me, there was a real cultural confusion. And I'm thinking, then I had to think about my lens. Am I coming from a perspective of, am I encouraging, you know, harm?
But I think it comes back, you know, like you said, really about being professionally curious and asking more questions and actually listening to the child. You know, one of the big things in the police and a lot of our strategies now is about the child's voice. You know, the new children's strategy that was only launched recently is about the child first, you know, put the children first. It's not, you know, about what we should do as good, you know, what is best for that child. And I think sometimes we forget that, you know, and we try and look at things from the wrong angle and through the wrong lens, probably.
And that might look different for different children because people, you know, I've got 3 children, and what's right for one of them isn't necessarily right for the others. And it's about getting the right support for the right child at the right time and liaising appropriately in the right way with the adults of that family, and taking into account that there may be barriers that they have, which may be English language for a start, you know, so those basic ways that we can communicate really effectively. But I absolutely get that, you know, that's what you know, having the child at the heart of those sometimes very challenging but supported discussions is absolutely key.
But also thinking about what resources that the family have access to, you know, so we, you know, as professionals, a lot of the time we really have these ideas that, you know, if I offer this is going to be brilliant, but actually can the family access that? And they probably might be able to access it for the period that we're involved, but actually when we are gone, and that's what we should be working with families, that actually we're not working with families for the long term, but actually it's specific time specific. What can they do
One
themselves?
size doesn't fit
Fit.
all.
Yeah, I mean, I
Absolutely.
worked in Camden in a particularly Bangladeshi community, for example, and I was involved in a family and I visited and I felt there was extreme overcrowding and there was a number of people and it was really difficult for me to even do the genograph, who was linked to who, And I was saying, you know, this is in my head, a neglectful environment that people are not living necessarily sleeping in fixed beds that look like a bed in my house, and it was overcrowding. And they took much offense to it, because what I've later learned is that it's not over, you know, the community, the village, the family raise their children together, but also to support. One gets married and they go and they buy a home. So in order to buy the home, everybody's got to stay there and they're paying, you know, small portions to rent just so we can send the next son out to buy his home and we can all support to buy a home. And that's the plan. But I'm thinking neglectful, overcrowding, people are not living in the circumstances that, you know, I think they should be living in. So it's about being open to difference and not necessarily making this big report about it, but where do we find that balance?
Well, I'm recognizing that. I mean, the whole construct of neglect can be misunderstood in itself, and then racially mediated.
What is neglect?
So, well, indeed, and what's poverty, and what's structural difficulties, and what's a misunderstanding of cultural traditions or customs. So, you know, in my experience, it's very rare to work with a family where parents or carers get up in the morning and intentionally want to not feed their children, neglect their children, not bath their children, not wash their school uniforms, all of the things, not clean their house or flat or whatever, all of the things that we associate with neglect. It's very rare that parents or carers say, well, today I'm not going to do that, and I'm not going to do that because I want to neglect my child's needs. No, it happens because there's challenges that they're facing in their life that we need to help them with. There's relationship difficulties, there's difficulties with alcohol or drugs, or there's difficulties with housing, or, you know, you've got rat infested. We've got a family at the moment and the rat is, you know, they've got rat infestation in their accommodation. So they're struggling to keep up with it. We go in and look, and of course it looks neglected. They've got rats all over their house. That's a housing issue to sort out. Rats and mold and whatever. So we need to have some kind of understanding to start with, and then recognise how those ideas are filtered through a race lens. If you're struggling with your mental health because of the trauma of racism, it's going to be a challenge to get yourself going in a way that's going to be right for your children every day. We don't want to come and make that worse and say you're neglecting your children. What we want to be doing is saying we understand the context that you're working from, and we want to help you with that. That's not neglect. That's requiring us to support families.
Sophie, from an educational perspective, what do you think neglect is in terms of children that we work with, and how is race impacted by that?
I think that within education, and this is something we've been working on with the DSLs in Wandsworth at the moment, about the breadth of neglect. And it's not just about lack of food and not being dressed properly. It's about emotional neglect, about medical neglect. And that's a key issue, especially when we're working with different communities, because different diagnoses look different to different cultural backgrounds, and you have to work really, really carefully with that, and about supervision and guidance, so that the breadth of neglect, rather than not enough food and your clothes aren't clean, sort of thing. So widely, and also maybe this is a good point to put now, is that what I found in Wandsworth with a lot of independent schools, that emotional neglect is really evident, and that mainly comes from fractious relationships of parents, not domestic abuse on the verge of, but the kind of constant. And that's when, in talking to some of our independent colleagues, that's what they're saying. So, and I think what we need as educationalists to really drill down more on is being very specific in our referrals when it comes to neglect, looking chronologically, looking at how the family has reacted to the support that's put in, looking at the range, and making sure that those referrals are far more thorough than I think sometimes they can be.
And I'm thinking of those fractious relationships, and in relation
And I
to
don't want to be
race.
stereotypical there, but I'm just,
And
kind
you
of
said,
saying,
and you
yeah.
said those affluent families, but I'm thinking about the families that come from single parent homes.
Yeah.
We have a lot of black and brown children that are raised in single mum homes, for example. And the way that you were considering those children in independent schools and the impact of those fractious relationships, do you think we're considering the impact of that fractious relationships in those single parent homes?
I think we're probably more judgmental of them, and there's more blaming going to the woman who's left, or the man who's on their own. I think that the approach isn't as holistic as it should be.
And we wouldn't get a referral. Let's be honest about that. We wouldn't get a referral from the independent. It will take a lot before the referral will come to
you're
children's
right.
social care.
And so that they often do a lot of kind of challenging, supportive conversations. And with a single parent family, what schools need to understand is, if you know your families well, if you know the circumstances, if you've built up a trusting, open door, safe environment, so that parents can come to you for help, you know what the situation is. And then what I see is schools should be putting in what I call school-based early help. So the process of really supporting with the breakfast club, the after school club, understanding that money's a bit tight because somebody's got to work because they're on their own. That's not neglectful. That's trying to do everything for your child. So looking and thinking, what else can we do? I do believe in it takes a village to raise a child.
Sometimes do you think we can do something? Do you think that sometimes there's nothing we can do? Because I am thinking about the 44 languages that potentially in one borough, and we will seek to understand. And if we were really to have a broad spectrum of all of these families, is it likely that we'll ever get it right? Because everyone's got their nuances. I've got my nuances, Black Caribbean family, and what happens on forms, I'm a Black family, but I'm not Eric's family, who's Black African. I feel that there's so much difference when it comes to race and culture.
But I guess for me, it's our job to try to understand. It's our job to try to get to a level where we try to have a conversation as to what would be helpful for you and your family in this situation.
I think if we were to say we've nailed it, I think that would probably be a bad thing, because society is going to evolve and things change. So I think we've always got to say we could do better, and then that allows us room to improve and to recognise that we're not always going to get it right, I think.
And I think really understanding the impact that different forms of neglect can have on a young person, a child and a young person, you know, on going forwards, that emotional abuse is emotional neglect is a huge impact on a child from the point of view of access to education, feeling good about themselves, so therefore access to education, you know, all those sorts of things I think is really important.
I think, you know, when you talk about emotional neglect, Sophie, I think that's racially and culturally and class mediated. So
Can be.
and it changes as time grows. So certainly there would be some racial groups, communities, cultural traditions groups where to not, I don't know what the word would be, but let's say kind of mollycoddle, to not over be over affectionate with your child is unhelpful. Now, in another setting, another context, maybe a white middle class one, that we might see that or understand that as an emotionally distant relationship, but that might be just not wanting that child to be overly
Emotionally attached. Yeah.
well when our job as parents might be to prepare them for independence, but we probably all don't even agree on what would be an appropriate level of emotional care between a parent and a child in our families, and that's not just through race, but race has to play a part, and then we will assess others on the basis of our view as much as what we think is okay in that family.
And I was thinking about titles. So, you know, in preparation to this podcast, you talk to people, and some people still struggle with even naming. Like it's told BAME is not to be used now. Don't say coloured. So somebody said to me, you know, coloured children. I was like, oh no, you can't say that. And then somebody said, oh, what's global majority? That I feel like we are the words and our language to families of different racial backgrounds is changing. How does this impact your services, and how are we keeping up with those, I don't want to say trends, but changes?
I think from a police perspective, people are scared because, you know, we don't want to offend, and it constantly changes. You know, if I'm honest, I didn't until I started my new role, and hearing people refer to black and brown people, which seems a relatively new thing. You know, I don't think probably a year ago we would have been too scared to say that.
I think so.
And I coming back into sort of frontline policing was like, wow, that's, you know, I actually thought, wow, you know, we're just being honest with it and, you know, recognising people for what they are. But yeah,
it's still uncomfortable though.
Yeah, but it creates uncomfortable. And then I think from a police perspective, people are scared, you know, of once again breaking that trust or saying something wrong so they get a complaint, or and I think we should be careful at not scaring people in having these honest, difficult conversations, because actually I think they're really healthy.
So for you as a white woman police officer, do you feel comfortable saying black and brown children?
I think now I've, you know, having been in a lot of partnership meetings in the last 6 months, it's become more comfortable. But if I'm honest, probably still not 100%. I wouldn't feel comfortable to just say it probably to someone on the street, because I'd be worried that I might offend them. To
So what would you
professionals,
say now though? Because, you know, again, we're learning to understand how would you approach a family that is what we're going to say black or brown now? And how would the majority of officers?
I think it goes back to maybe asking people, you know, if it was someone that you hadn't worked with or you were working with, you know, how would you like us to refer to you, you know, by name, or, you know, or what do you identify as? I guess that comes back to sort of in policing, we'll always use a self-defined ethnicity and asking people what they classify themselves as. And I guess that's the best way to get it right.
And I was thinking about classification because it's, again, working with MASH, I learned, you know, IC1, IC3, IC, even those for me are so discriminatory, but we still use them. You guys still use them. So even though you're saying we've grown and we've changed, it's still an IC3 male. When are we going to change those systems?
Well, I think they added in the self-defined to make it slightly better. The self-defined ethnicity. So you would ask someone and they've then got certain numbers.
No, but when you're running after boy down the road, you're not gonna say, "Hold on, we're not gonna say that bit. He hasn't self-defined yet." Do you know what I mean? You're gonna say, "I see free male, da 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 da," and you're gonna run after him, aren't you?
Yeah, no, you're completely right. I mean, and once again, it's not something I've actually personally really ever thought about, but when you sort of say it like that, it does sound quite bad.
It does. It's terrible. Eric, how are we getting to grips with titles?
I think for me, I guess I think about me being a dad and how I talk about race with my children. And because we can't get away from that, I don't feel. We can't get away from a situation where you look at me and you think, oh, what do you identify? No, you see me as a black man. Like, we can't get away from that. So I think we need to get to the space where we are comfortable in actually saying, Eric is a black man, and then be curious about actually what else, if Eric would want, what else would Eric want to be identified as? And that's really, really important. Because if you ask me, yes, race is probably the first thing that you would see, and you will have an idea about what my life may be like or my experiences may be. But once you start speaking to me, it'll be very, very different to the next.
And that's the question that we should be asking, right? We should be, take Laura's point, and I guess this conversation, we should then feel brave enough to be able to say. So I would want to say to her, well, what kind of black man do you want to be? You know, we've got a lot of available stories about black men and identity and what kind of black men they can be, and lots of them are negative. And if I was working with Eric and he was a family that I was visiting as a social worker, I would want to have that conversation up front. I'd say, I'm defining myself as a brown man, you're defining yourself as a black man, you're a black dad. What kind of black father do you want to be? You know, do you want to be one who's seen to be aggressive, or one who's seen to be walking out and abandoning your children? Or do you want to claim a different narrative to be a black man? And how does your race mediate the way in which you think about yourself as a black man, and how you think other people see you as a black dad? And unless we can be comfortable to have those conversations with each other, we're never going to be able to move beyond just going on, well, you know, I've got this idea of the kind of black man you are, and that's how I'm going to behave towards you, because that's the box I'm putting you in, and it's probably a negative one, because that's all the stories that we hear about black men. So, and he'll be unfairly treated, so we've got to move beyond that.
Sophie, I'm thinking in schools, teachers, administrators, what language do they use to speak of children that we now refer to as black and brown?
That it would be based on ethnicity. So we would, when we looked at the whole of our population in the school, we would break the children down into main ethnic groups, their ethnicity, because that's what people write on an
Black
admissions
African,
form.
black.
Yeah, and that would be dependent on how the parent classifies themselves. Now, so that and there's a range of it, and it uses the Home Office kind of, which have become much broader. As a parent of dual heritage children, when my first child went to school, the only choice I had was other. And I absolutely refused to write down that my child was other, because they're not. And so I would write on any admissions form in like huge reams to outline, what their cultural heritage was. And that's changed. I see that with my own children. I was listening to my daughter talking to somebody the other day, and she said, well, I'm mixed. And that's what she feels comfortable in describing herself. And I can't, if somebody, I would describe my children slightly differently, possibly. I don't know. But within schools, but I would respect her for her perception. I think we would say, I think that black and brown is a newer term, and I think it's quite helpful actually. But I think that you've got to go deeper than that, because the cultural heritage of our black and brown families in schools is really, really important, and also to an extent the cultural heritage of our white children is really important to them. Our Polish child, hence, but within my school, where I think I had 2 white British children, the richness of diversity and cultural heritage of my black and brown children was something that we wanted to really, really celebrate and make sure that we reflected in the work that we did in school. And I think that's really
But
important.
we have to remember as well that that's just as you say that, Sophie. I'm thinking, well, it would be an easy leap to make in the same way to assume whiteness is this, and actually the richness and diversity and whiteness needs exploring too. So often our social workers might say, well, if they're a white social worker working with a white family, they don't need to have a conversation about race, but of course they do, because they're white and the family's white. But how you do whiteness is as different as how Eric and I do blackness and brownness, and how you two do whiteness. You'll understand it and do it differently, right?
And when I was kind of trying to find a supportive person to work with a family who needed more help, I would look at a myriad of different capabilities and attitudes and experiences and skills that different people could bring to that scenario. Very much I would look at the cultural identity and the kind of matching that way, but that person may not have any other skills. So it was sometimes,
But one of my challenges still with black and brown is colorism. So, for example, like my daughter, who is of a different generation, if I say to her, "You're a black girl," she's like, "No, I'm not. I'm brown." Whereas Asian, Indian, Pakistani would say that they're brown people. But according to her, her skin is not black. Her skin is not a shade. She feels, "I'm not black. I am a brown girl. I'm the brown girl in the ring, tra la 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 la." And it's such a complex type, when we keep putting titles.
But the colour is a signifier, right? So we use the language as a signifier. So we all understand here, I think, what we mean when we're talking about black and brown. We're talking black African Caribbean, black African. We're talking brown South Asian, right? That's what we're all thinking. So using the word is just a signifier.
We still need to understand.
We still need to understand it, though. We still need to deconstruct it. But that's the difficulty. Is because race is complicated, we reduce it to ways in which we understand. So we reduce it to language like black, brown, as if that encapsulates the whole of the racial identity experience. Of course, it doesn't. But we can't. But we don't have the language or the brain capacity to do that in the way in which we talk. So we reduce the complexity down to really simple ideas or words.
But then couldn't people say that that's where coloured came from? Because other than white, you're a colour.
Yeah.
But then that's offensive.
Well, some people may refer to people of colour, right? So you might say, I'm a person of colour.
When you're working with families and trying to match sort of workers or support staff to the family, and I think even in doing that, we must always create space where we have conversations with the family that we're trying to find that support for. So, for example, we know that some families that I've worked with, they know that the communities are so small, so they may know that actually no, I wouldn't want to work with somebody from my own community. I might actually prefer to work with somebody from outside, because actually that information might
community pressure
absolutely might easily slip out. So again, it goes back to that conversation with the family in trying to understand what would be helpful.
And what I was going to say before was that breaking our groups down further to their ethnic backgrounds means that you can really drill down to find. That's where data is got from school. So you can really look. So you can look at how your Indian Asian children are doing, your Pakistani Asian children are doing. You can then identify the gaps and think, and then step back from that and think, okay, what is this data telling me? What can I do differently? What other information do we know about that group in our school? So schools do break down their data in a lot of ways, and schools who really are focusing well would look at their mixed race Caribbean, Black Caribbean and white children separately, because that's different, and we need to look at that differently, because there's different way to approach.
So thinking of difference, I'm thinking about the children that have experienced racial trauma and how do our agencies respond to supporting children in a safeguarding capacity to manage the racial trauma that they may have experienced?
Well, you have to, I guess you have to recognize that they have experienced racial trauma. And is that trauma is it generational? Uh, is it that I haven't, but actually my parents have, and in their parenting of me, that trauma lives through that parenting. So we really need to then, it goes back to those conversations that we're having. Um, and and I think, and I think again, supporting parents to talk about that, creating that space to be able to talk about.
Because if you were a black father, a black male that has, historically been targeted by police officers because where he lives, I'm from, for example, I live in Angeltown in Brixton, and it's notorious for a particular criminal lifestyle. And I'm just a black man trying to get my degree and go through life. But because of where I live and what I look like, I've experienced certain things. And that narrative I've now passed to my children, who then have now developed that fear of police. Do we consider that when we're working with families in your service?
I would like to think so, but I do think it's one of the areas that we probably haven't recognised maybe until recently, when we've come under a lot of criticism. And I know there's a lot of work at the moment. They've just released a race action plan, and that is all about building as I said earlier, trying to build those trusts with communities, and use, I think, those bad experiences from people to try and educate officers and bring it into our training so we can understand, firsthand how that feels, and try and break that cycle, because it's really hard. Like, it's a generation thing, and if we don't stop it now, it's just going to keep going through generations and
Because when you're knocking
generations.
down the door of a known house and there's children inside and you're going for this parent, I mean, we had someone at our conference, Lily, last year, who spoke about being a 7-year-old when the police, broke into his home looking for his elder brother, shot his mum, and he's now, in his late 40s, and that's lived with him. And there was very little recognition from the police force of even their planning, and thinking there's children going to be sleeping in this household at this time, and the actions, but it was so focused on this black man committing crime that they don't care. They're just going to go in and do it. So for me, there is still work to be done.
And can I just say, things like that still happen.
It still happens.
Yeah, it's not. He was telling the story of many years
Yeah,
ago.
the 80s.
But I had a family where that exactly happened. One of the first questions, I had many families where that happened, and there was one recurring, and our police colleagues knew there were young children in that house, and those children came to school traumatized every single day. And I remember one of the parents saying, "But I don't understand why they would do that to my children, because it was really, really traumatic." And I guess when it's an emergency situation,
But like you said, I still think there needs to, as part of the training, there needs to be that recognition and thought
And
process.
planning.
And even if, they have to do a job, which sometimes they do,
Yeah,
it's
but
having a plan for
exactly,
that.
we all have
You
to
take the
plan.
children to the side, or
Exactly, like,
you
for
bring in a
example,
social worker with you, or there's various things you could do to try and make it better.
And I have an example where I've worked with mental health services and the police and school, actually, where we were able to plan an intervention for a family, where we were thinking about the impact on the children should police and mental health services walk in to actually section mum. So we were able to think about that. But again, within that, so just speaking now, I'm just thinking, if that wasn't me, because I was coming from the lens of a black man and these are black children, would we have been able to get that? Because we were quite meticulous in terms of making sure this is what auntie, grandma, this is what people are going to do in this situation.
but it's being sensitive. So, even on Fridays, if you're working with an Islamic family and that it's prayers, and, why would you go and plan your visit then, or do those things? It's about thinking about who this family is, what their culture may be traditionally like, until you really get to know them, and planning accordingly. So I'm going to ask, as we close, a vision that you would like for families and professionals when we're looking at what is your vision for achieving equitable outcomes for children in relation to neglect and safeguarding, considering their race. One from each of you. What would be your vision?
I think my vision, would just be to have better relationships with the community and start to build those, really healthy, and earn those trust and confidence back in the community, so that and we can have those healthy conversations, and just work together collaboratively, I guess. And I think we've got a long way to go, but I do feel, I've been in the police 24 years, and I feel this is probably the best we've been at recognising that and being honest and recognising it. So
Yeah, I mean, the vision would be to work from an acceptance of the reality that the system is unfair. It's not a level playing field, and to recognise that in the way in which we work with children and families. So always to be challenging our thinking so that we can do different.
One size doesn't fit all. Understanding and responding appropriately, child-centered, and really strong communication, which means really listening and hearing. So, listening with your whole kind of being, and people communicate things not just by what they say, it's by why they are, and that you can, when it comes to children, that's really important. So really listening, and when you have these challenging and difficult supportive conversations with families, to make sure that you keep quiet and you listen and hear what they're saying and ask the right questions.
Certainly, I think probably for me, there's something about meeting a family where they are, and really trying to understand that family, trying to understand. So, this is a referral about neglect, but actually, let's be curious about what else might be going on. What other factors might be influencing this family, might be contributing to this, and trying to understand, I think would be something that I would say, yeah, will be a vision.
Thank you. I mean, we could explore this for hours, but I'm sure these people want to save children in Wandsworth in their capacities. And I want to thank you for joining me today. And I hope we've all taken something about the racial lens on neglect and how we can do things differently, how we need to do differently and to challenge differently, explore, be curious, and to name it and be confident. So until the next time, thank you.